Welcome everybody. This is the Medicare Secondary Payer Introducing the Contractors webinar. My name is Tom Ryan with WPS Provider Outreach and Education. I'll be your presenter today. I'm joined by Alan Vera. She's another member of our team. She's going to help me with those chat questions that you put in. She's going to go ahead and give you any technical support she can, anything like that. So you'll be hearing from her a little bit later on. I did start a recording just so everyone is aware. I'll talk about that in just a few moments. One of the things I want to make people aware of is that this webinar is in response to the questions you asked and the questions you submitted during our previous webinars. We do have a variety. We did originally think that this was just going to be a 3-part series. It's now into a 6-part series. We've also got some more education coming with Medicare Secondary Payer. So keep watching those so that you can get, the billing one coming up later, which is next month, I believe. And then there's going to be a wrap up and a variety of other things. So I want to make sure you're aware of that this grew into a much larger than anticipated process. So that's why Introducing the Contractors became its own class. One of the questions that was addressed or that asked was, is the MSP information on the portal going to be different or change once the portal changes? Now, keep in mind, for those of you that are not aware, our website secure section is changing. It is a look and feel update. What is actually being enhanced is going to be underneath the systems. So it's going to make it more secure. It's going to make it more stable, and it's going to make it act a little bit faster. Not really things that are going to affect you. Here's what is going to change. Where you select things, how you navigate it will be a little bit different. Keep watching our YouTube channel. We are putting more information out on that in that way. Also, we're sending out some e-news on it. We are anticipating this to be done by the end of spring 2024. That means by June-ish. So keep that in mind, and I did want to make that everyone aware of that right away. Let's start with our disclaimer and move on from here. First, this presentation is for educational purposes only. The information is available and was available and hasn't changed or was current as of this morning. Information does change for Medicare though, so keep in mind you always want to check back for the CMS website and make sure the information is still current. As I said, we did take pre-submitted questions during the registration process for this webinar and others, and I can only give you responses based on the questions and the facts that you've given me. If I don't have that, it may change the answer. But keep in mind, that's where I would ask that you verify or you ask additional questions or clarifying questions. Give us comments in that chat feature. It will help you as we go through. I do want to let you know that I want you to enter those as quickly as possible while you have it in your head. Don't try to hold on to it and come back to it. You may forget and may not help you in the long run. As I said, we are recording this presentation. Now, we do ask that you do not record for profit-making purposes or purposes at all. We ask that you don't record, don't do screen prints, don't do anything like that. What we're going to do is take this recording, we're going to put it on YouTube. What we'll do on YouTube is make it into an encore presentation. You'll be able to find our encore playlist available to you on YouTube. There's also going to be a link to it directly in the chat, so you can go ahead and grab that. We will put this onto our website as a YouTube encore presentation, and it's going to be available for 60 to 90 days following the date of the event, depending on how long we get it out there and a variety of other factors. So if you are recording, we do have to ask you to stop and to use our recording eventually. All right, moving on to the agenda. Our goal is to help you learn which contractor performs which function when it relates to Medicare Secondary Payer. Because again, there's a variety of contractors and players in place, so we want to make sure you understand the different functions each one has. So we're going to cover the contractors, who they are. We're going to introduce them first. Then we're going to explain the different roles. Now we'll focus on the explanation part specifically to MSP. On the other hand, the introduction will introduce a few other contractors that are affiliated, associated, or are not part of the MSP process, but may affect MSP overall. So we'll talk a little bit about that. I know resources is listed as a separate item here. I will show you different resources throughout, and some of those we're actually going to use to answer questions that you submitted. Now, before I leave the agenda, I did get a few questions that were submitted, and I want to make it as clear as possible as to what this is, because a couple of them led us to say, hey, can you start off with what is Medicare Secondary Payer? Can you define it? Can I help you understand it? And I will do that. Then I'm going to stop. We'll take a few questions, and we'll move on if we have any questions. So before I leave this agenda, this is not part of your PowerPoint presentation. This is based in the questions that you asked me. If you want a fuller explanation or more information, do check out our Encore playlist. It will give you a better explanation from previous classes. But here's the basics of it. So what is MSP? It is Medicare Secondary Payer. Now, Medicare Secondary Payer refers to a section of the Social Security Act which is 1862B. 1862B. This section of the Social Security Act requires that certain people pay in front of Medicare or consider their charges in front of Medicare. That's why it's Medicare secondary payer. Now keep in mind, we say consider, sometimes we'll say pay. It doesn't have to be pay. So if someone applies it to a deductible, or if another insurance applies it to a deductible, such as an auto or a homeowner's policy, or even an employer-based plan, that's okay. They've considered the charges and they've said, we're not paying because it's going to deductible. Maybe they consider the charges and say, this isn't part of our plan, just like what Medicare would do, right? It's not part of our plan. We don't offer coverage for this. That's okay too. So Medicare secondary payer is a little bit of a misnomer according to some people because they don't feel like it has to actually pay for it being the other insurance or the primary payer. Now, keep in mind, primary payers do not have to be another insurance. They could be something as simple as a self-insured store. So you fall at a store, they have liability, and then that store does not have liability insurance. That store would be considered self-insured. So there's a variety of different factors that go into that. Again, that's a very high level. Another question we got is Medicare secondary to the Veterans Administration or VA? And the answer is no. These are separate individual plans or separate federal programs. They're not primary, secondary to each other. If you want to learn more about the VA, take a look at our website. We are offering a class on that coming up later that'll explain how that works. I don't want to get into that a whole lot here, but I do want to give a little bit of a base there. Another question before we move on was, does this course apply to Part C plans? Now, Part C plans are also known as Medicare Advantage plans. These are a different portion of Medicare, and this course does not apply to them. Instead, this course applies to Part A and B, also known as traditional or original Medicare. I work for a Medicare administrative contractor, and we process Part A and B claims. We do not do Part C claims. That's a separate set of regulations. It's actually a separate portion of the law. So you want to make sure you're aware of that. The last question before I actually get into the contractor portion, and I want to make sure we're clear on this. So if you have questions, I would like you to put them in the chat at this time, is can you show me the Social Security Act and can you show me what you're talking about? And absolutely, I can do that before we leave here. So first thing I like to do is open the Social Security Act. Now, I already have it up. If you don't want to do that, I did give you the reference for it. So if you said, I don't really know what that Social Security Act is, I can type SSA, which is Social Security Act, 1862. By doing that, it will automatically bring me up a link. What's great about it is it's going to bring me to Title 18, Section 1862, and then I can go through once I open this and scroll down. I'm not going to actually scroll down on this one because it does take a little bit to get through it, and you do have to find it. You can see it takes a little bit to open it. Instead, it's going to look like this page. And then you're going to scroll down to where the information is at within it. So you're looking for this B, which is Medicare secondary payer. So again, I am in actually 1862 of the Social Security Act. Very formal written document. It is a law, so you got to read through it, but you want to look for B down here, and this is Medicare secondary payer. And then it goes through all these different informations, exclusions, information like that. So it is here for you. You do have the opportunity to read it. Again, you can see here, it opened up at A. If I just scroll down, eventually I will come to B. Same thing. So just a good opportunity for you guys to get some more additional information if you're looking for that. Hopefully that will help you out a little bit. I will cover some other resources a little bit later on, but I wanted to give you those basic things. As I said, I'm going to stop for a moment and just ask Ellen if we've had any questions.
Tom, we don't have any questions at this time.
All right. So that brings us back to our agenda. And we're actually going to move into introducing the contractors. So this is where we actually begin with the information for this course. So hopefully the basic information I've given you is enough to get you through that Medicare secondary payer first primary set of questions. So who are these contractors and why is this important? Under the federal government, the Center for Medicare and Medicaid Services is the actual one that administers Medicare. During this process, CMS does not do the whole program themselves. Instead, they hire contractors other companies to act on this behalf. And that's where these contractors come into play. Now, along with that, though, they are still involved, and there are some times when they will look at things themselves. So let's talk about these contractors, and I'm going to give you a little bit of an overview before we get into super in-depth detail. I want to introduce you to them. We'll talk about some other entities as well. So there are three primary MSP contractors. There are two that are actual MSP contractors, and there's an affiliated contractor, and we'll talk about that. The first contractor is the Benefit Coordination and Recovery Center, commonly called the BCRC. Now, when you hear the term MSP contractors, it's going to refer to the BCRC. The BCRC, or Benefit Coordination and Recovery Center, is exactly what it sounds like. Their job is to coordinate the benefits, track who has primary insurance to Medicare for whatever reason. They also then will update the system. We'll talk a little bit more about that. Then they also have the job of recovering certain payments, and we'll get into that in just a few slides. So their job is multifunctional. The Commercial Repayment Center is a company, and their job is to collect overpayments involving employment-based plans. Now, these overpayments do not come from you, the provider. That's why the Medicare Administrative Contractor, or MAC, is listed here also as an MSP contractor, because we do all of the collections process for providers. And the MAC is WPS. We work for J5 and J8, which is Iowa, Kansas, Missouri, Nebraska, and the national contract. And then J8 is Indiana and Michigan. And so we process all these claims, we do the overpayments, and we work with the provider community with one exception, and that is updating the Benefit Coordination System, the BOC system, and that's the Benefit Coordination and Recovery Center. So these are your three basic contractors when it relates to MSP. I'll get into some more details of what they do, but hopefully that gives you just enough information to kind of understand those three contractors. The next slide was built in to answer some questions that we got. And they said, who else can be involved, or what else could happen, and what other entities are actually involved with the process for Medicare secondary payer? And so I thought, well, let's just list a slide. We'll go through each one. So the Medicare Administrative Contractor, as I said, processes claims, right? That makes sense. But they'll also issue the overpayments and the requests. They're also involved from a medical review standpoint. So they will complete medical review, but if a claim fails, Medicare secondary payer, in other words, there's a primary payer and that information's not there, medical review will not be completed and they can actually reject a claim. So they won't even do a full medical review. They're going to say, nope, we need this instead. And this is what's going to happen. We're going to talk a little bit about how that happens in just a few slides here. The Qualified Independent Contractor, or QUIC. Now, the QUIC does a variety of different things regarding fraud and abuse and some different reviews for inpatient reviews, but they can look at things from a patient perspective. So there's a lot of factors going into it from their perspective. The Medicare appeals process is involved, and so that would be your overpayment appeals and other things like that. So that's why these people are all involved as well. I guess I should have said that right away. So when you look at it and you say, hey, I don't want to have to pay you back the money, it's an overpayment appeal. It's not a claims appeal. Please don't confuse the two. So level one would be your Medicare Administrative Contractor. We also do that. It's a form of medical review or administrative review. Okay. Then the Qualified Independent Contractor, or QUIC, which does a level 2 review, and they'll actually look at it from the perspective of making sure we did everything correctly and timely. Office of Medicare Hearings and Appeals, many of you may have heard the Administrative Law Judge, or ALJ. They're involved at this level. Now, an Administrative Law Judge works for the Office of Medicare Hearings and Appeals. So that's who this is. That's the bigger picture, and then who actually does it. The Medicare Appeals Council, some people will hear Department of Appeals Board, however you want to call that. The council is a very common term used for this one. And this is level 4. And last is the U.S. District Court. So each one of these can be involved, especially with Medicare secondary payer and with those appeal processes on the overpayment. Now, it doesn't matter who's issuing the overpayment, because remember I said a BCRC could issue it to a patient, or we, the MAC, will issue it to you, the providers. And so it doesn't matter who does it, they're involved. What they're going to do is look and make sure, one, the records are updated, two, that the overpayment should stand as it is. Because remember, a patient can appeal anything they want. Providers do have some other workarounds that they have to get done first. Okay. Then you'd also have, along with those types, you have some medical review entities that get involved. And this is the Comprehensive Error Rate Testing, or CERT entity. One of the questions that came in is about the cert and how they don't do a review or they'll automatically take money back from a paid claim. And why does that happen when it comes to MSP? And the actual answer to that is it depends on if the system was updated to show there's now a primary file. If that does happen, then the claim is not considered processed correctly and the actual money can be taken back. Now, it has nothing to do with what you would typically call a medical review or a full medical review or like a person sitting down and reviewing it. It's more that administrative step, but they can do that. So could the recovery audit contractor, if they find that now there's this record and it wasn't there before, so now we're going to take money back, they can do that as well. But these are considered Medicare medical review contractors. And so what they're looking at is, was this claim paid correctly? That's where the cert and those two come into play with that. So lots of different affiliated contractors or other entities involved. And so we thought we'd put them out there to kind of hopefully help you understand what the appeals process and then with medical review. The key question that we were trying to answer, especially for medical review, is how does it happen that a medical review starts to be occurring? You send in the documentation, but then all of a sudden you're getting a recoupment for Medicare secondary payer. And that's because the record has been updated. And the record now shows that it is a current active case for Medicare secondary payer. Therefore, we can't complete the medical review, which will initiate the opening of a repayment or an overpayment based on the Medicare secondary payer, not necessarily a medical review. All right, so that's going to bring us to the series of questions. And again, some general information. I've given you some basic, and then this. One of the questions that came up is, where can I locate the CMS information on each contractor related to MSP? And I will bring that up as we talk about MSP responsibility. So I thought this was a great opportunity to bring that up. Let me just show that to you real quick. So when you're out in the Center for Medicare and Medicaid Services website, I do recommend that, if you're searching for something, it's great. You can simply search MSP. I'll do that in just a moment. But you can also navigate. So you're going to go Medicare. Then you're going to come down. You're going to look, okay, do I want coverage? What am I looking for here? And you can just see I'm just kind of moving down a little bit here. There's a variety of different items to look for, but if you go all the way to the bottom, you'll see coordination of benefits and recovery. And this is where you want to go. Now, remember, it's Medicare coordination of benefits and recovery. It's where Medicare secondary payer information will be located. So if you click on the overview, it will open. It's selling out a little bit here, just waiting for it to open for us. And so then you can see Medicare secondary payers actually listed as a second item on the navigation bar on the left side. It does talk about the benefit coordination of benefits and recovery overview, a little bit about the program and how all of that works. This is going to be a primary source for you to come to when you're looking at who does what, which is the next section. And again, it's also going to look at some of those coordination and why the patient or another insurance or even a lawyer may work differently than you do when it comes to primary payers. This will contain that information. All right. If you're also looking for, another question was that we've seen the Social Security Act and we've looked at the administration of that. What do I look for when I want to come back and I want to find day-to-day operating instructions or all that information given by CMS translated from the Social Security Act and actually making it work? So I do want to show that to you again before we get into responsibilities, because all of these responsibilities are then defined in the Medicare Secondary Payer Manual. Let's jump back here. This time we're going to take it even a step out and we're going to go to cms.gov. Inside cms.gov, you'll see we were just on this. I didn't want to leave that page. If I go to Medicare, this time I'm going to go to manuals under regulations and guidance and manuals. Okay, so this is key, internet-only manuals. Day-to-day operating instructions. How do we as a contractor and you as a provider have to work with Medicare? Day-to-day operating instructions. Internet-only manuals, if you scroll down, you will see 100-05 publication number, and you'll see it's actually the Medicare Secondary Payer Manual. By selecting this, you can open up all of the different chapters and read through all of the different criteria. Now, as I said, there's a variety of other criteria and things I want you to be aware of. Just keep in mind, you can read through all of these different chapters and sections as we go through. If there's one particular item that you want to be aware of, we'll get to that in a little bit. So I just wanted to answer those questions as we went through and we were talking about these different responsibilities. Ellen, in the meantime, do we have any other questions submitted?
No, sir, we do not.
All right, let's get on with it then. So next is MSP responsibilities. Now this is the section that we're actually going to talk about the MSP contractors. So not the overall broad picture. We're going to focus on those 3 contractors and we're going to tell you what they do. It's key information right here. The first one actually becomes one of the most important contractors, and this is the Benefit Coordination and Recovery Center. You may have heard me mention this, that BCRC. Their primary job when Medicare first starts, before we get into the Recovery Center portion, is to establish that there is or is not a Medicare primary payer. In other words, is another company, is another entity, is another person responsible for paying before Medicare, BCRC. They're the ones that actually control the coordination of benefits system. Now, the coordination of benefits system is an information gathering system that they enter all of these different records into. Once the record is entered, it goes into what's called a common working file. Now, the common working file is a reception or a hub, receptor. It's got a variety of different names. People like to use different annotations for it. But the common working file in and of itself is what allows everything to communicate between Medicare. So our claims processing systems, our eligibility systems, our coordination of benefits system, our Part C eligibility system, all of those different systems talk to each other via the common working file. So the job of the coordination BCRC for the coordination portion of this is to actually go through and establish, is there an MSP record? Should it be established? And this starts right at the beginning, right when a person becomes eligible for Medicare. They'll send out a questionnaire, they try to establish whether or not they have it. Once they've done that, we want to make sure that they keep the record up to date, and that's as current as possible. Now, we did get some questions, and I'm going to talk a little bit more about that coming up in a little while when we get to the next set of questions. Another portion of their job is to gather the information to stop claims from paying. Now that sounds a little harsh to say that, but if we can't determine who's primary and what dates they should be primary for and when this should or should not be primary, that's their job, to get all of that information and in the meantime kind of hold everything up until that happens. For the providers, they can also answer general MSP questions. Now, these are pretty basic questions, and you know, an example might be, hey, we don't have system access, but we know this patient has another insurance such as employer-based Blue Cross Blue Shield. We just don't know if they're primary or not because we don't know the number of employees on the plan. So, okay, I don't know. And they'll answer that question. They can help you out with that. They can investigate any potential primary payer situations. And this is a wide range of situations. And that's why they can also put a hold on the claims to stop them from processing why they do that investigation. So there's a variety of factors that go into that. They also then work as a recovery center. Now keep in mind, this recovery center does not recover from you, the provider community. They do recover from the beneficiaries relating to non-group health plans. Now, a beneficiary or another insurance is what we're talking about here. Could also be a legal representative or a lawyer in the case that there's a lawsuit. So they do have a lot of different functions. One of the key things there is non-group health plans. So when we look at the CMS website, if you go into their responsibilities and you go into that page underneath there, it'll actually show this to you. So if we jump back to the CMS website, we're going to go back to that coordination of benefits page, and then we're going to look at the coordination of benefits, right? This is what I'm talking about for the first part. And underneath there, it'll just say, hey, what's the process? How does all of this work? It's basically everything I gave, except in a lot more detail with a lot more information. Again, feel free to take that if you'd like to learn more. Also, non-group health plan and group health plan recovery are right below it. Take a look at these. This is where you'll find the BCRC non-group health plan recovery information. It's actually right here talking about their responsibilities as it relates to this. Yeah. So that's the BCRC kind of in a nutshell. Their job really is, in terms of what a provider will know of, is to update those records, keep them current, and again, put places and stop pays in place to help Medicare make sure we're not paying anything incorrectly while they do investigations. So that's really what they're up to. All right, jumping back to my PowerPoint for a second, let's talk about the Commercial Repayment Center. Now, as this one says, this is a repayment center, so they're a recovery contractor. They, again, do not work with the provider community. The Commercial Repayment Center, on the other hand, it does work with other health insurances. It could work with a patient to get money back if they owe that. Keep in mind that would represent a legal matter for the patient, not necessarily the patient themselves. There's a variety of things that happen into that. When we talk about providers, you will only work with the Medicare Administrative Contractor. We just haven't quite got that far yet. So this is the contractor that's responsible for looking at group health plans, workers' compensation, and liability insurances and getting all of those monies back when they're involved. So different than the other one, which is the non-group health recovery, this one is the group health recovery. And so they're very rarely going to contact you in terms of the BCRC or the CRC, because they're going to contact us if we need to take money back from you. Medicare Administrative Contractor. On the other hand, sometimes during an investigation, they may contact a provider to try to get records or to try to get something to try to figure out what's going on. If you do happen to receive something from them, please respond. If you're not sure who they are or if you should respond, always come back to the CMS website. Take a look at, again, the overview section under Medicare Secondary Payer. We're just going to scroll down. It'll have your contacts right here. Okay, so again, Medicare Secondary Payer, the coordination of benefits. I'm just in the overview, and I'm just going to scroll down, and I'm going to go ahead and select the contacts. It'll tell you how to get a hold of everyone. Feel free to reach out, ask them questions. Are they contacting you? Don't just randomly respond. We don't want that kind of fraud and abuse stuff to come up. We want to make sure we're responding when appropriate. So, but it will tell you how to get through everything you need to get through here if you need to go through any of these contracting. Now, again, these ones will be special projects or other things. They're not typically going to be your normal area of response, with one exception, and that's the BCRC. And that will be when you want to initiate a record update, but we're going to talk about that in just a few moments as we get to some of the questions that are coming in. All right. Next contractor you need to be aware of, and we talked a little bit about this, is the Medicare Administrative Contractor, and that is WPS. What is our job? Our job is to issue a conditional payment should you request one. Now, Part A providers billing on a UB04 or the CMS 1450 A37I institutional electronic transactions, you can request it directly on the claim form, and you'll make sure you submit some coding for that. If you want to know the coding information, I do recommend that you attend the classes that we're going to have next month. That will actually go through how to code everything correctly for a claim. It's going to talk about what needs to be there. Part B, it is a little bit different for conditional payments. And Part B is defined as 1500 billers or 837P electronic transaction billers. Your coding is different because you don't have the same information available on the claim. So you do have to put a little bit of different information. And sometimes you even have to contact Medicare to get paid, which means you call the contact center and let them know that you need a conditional payment. Also, our job is to handle anything claims processing related. This would include Medicare Secondary Payer claims. So our goal is to then answer any of those questions. Why did we do what we do? What's going on with it? Sometimes the answer will be, we didn't process it, or we're in hold on it, or it denied because of the coordination of benefit system, which would be the Benefit Coordination and Recovery Center, right? That BCRC entering a file. So you want to make sure you're aware of that. We also do have to recover payments. As part of that payment recovery, we will mail you a letter and we'll let you know that you owe us money according to what we know. Then you can respond, and that would be through the appeals process. But always remember, you want to appeal the overpayment, even if it's related to Medicare Secondary Payer. You're still going to appeal the overpayment. That is a question that we got. Do I appeal the original claim or do I appeal the overpayment? And it's always the overpayment. We will then handle the level 1 appeal. Any information sent in during this level 1 appeal will be transferred to level 2 should you choose to go that far. Same thing through 3, 4, and 5. If it was sent in at level 1, it will go to level 2. Level 2 will give all information sent in plus anything from level 1 to 3. And imagine that going up the ranks through level 5. So I want to make sure that you're aware that we are the ones that do level 1 and level 1 only. A couple people did ask about a reopening and can you do a reopening? And the answer is it depends on what you're trying to reopen and what you're trying to do. In some cases, yes. In some cases, no. And I want you to keep in mind that when we talk about reopening, it's a clerical error reopening. This is commonly used for Part B claims submitted on the CMS 1500 claim form or the 837P electronic transaction. It's commonly done in our portal, and it is something that does allow for it. But most MSP claims are considered too complex and may require you to do a reopening in writing. All Part A claims, which are UB04 or 837I, if you're trying to do a reopening, must come in writing with MSP. It's just too complex to do it any other way. This does not mean you could not do a claims correction and direct data entry. This is different than a reopening. Claims correction is only available for those submitting on the UB04 837I and you have direct data entry access. So please make sure that you're aware of the differences there, but we do handle anything relating to the claim. Just because it's an MSP claim does not mean we get to go somewhere else with it. So yes, that definitely is ours to work with. All right, a couple people asked, is there a difference in processing a claim when it comes to Medicare secondary payer versus just a primary payer claim? Oops, sorry, forgot to flip my slide here. And so the answer is slightly different, but for the most part, it's going to go the same. Here's what's going to happen. It's going to come in just like it would electronically or on paper, and we're going to verify that there is no Medicare secondary payer record, or if there is a record and it is active, then you want to go ahead and put that information on the claim so that we have it, right? That's where all the information has to be. Now, keep in mind the different coding has to be there. So we want to make sure everything is available to get through that information. Once we do that, we'll run it through your base edits. Hey, is this person eligible? Hey, is this provider eligible? Those are just some real base edits. And then it's going to run through medical necessity edits. Is there a policy affecting this? Anything like that? It's going to come through and it's going to hit that payment floor. Now remember, the payment floor is where we wait a certain number of days before we issuing payments, before we issue any payment. At that point, when we get ready to release from the payment floor, that night before it gets released, again, 14 days for electronic or 29 for paper, we have to run it back through the system again, which includes the eligibility system, but also includes the MSP system. So even though you've seen it pending for a number of days, waiting until you pay, right? Then what's going to happen is, oh, now I got to run it back to the system, and that's where it affects and can actually reject again. So I think that's what the people were looking for, is at what point do we actually look for the Medicare secondary payer information, and it's actually twice as your Medicare administrative contractor, at the beginning and at the end. So again, that's going to be some stuff that you want to be aware of. Hopefully that answers that question. If not, put it back in chat. I'll get you some more information. A couple more questions related to this section before we open up. Best way to help the patient update the coordination of benefits system, or the COB. Now that's again going to go through the Benefit Coordination and Recovery Center. We can't give you advice on this. On the other hand, we can't tell you exactly what you have to do. We can give you advice. Keep in mind, this is just some advice. One, work with the patient. If they're in your office or if you have them available on the phone, call the Benefit Coordination and Recovery Center together. The patient can always give you permission to work on their behalf. Keep in mind, it's not good forever. It's only good for that one call, though, if you're calling. Other things you can do. One, get information from the other payer, whether it's an insurance or whether it's a person or whatever the situation is. Get information from them. Tell us when it became effective, and also, is it termed? Did the coverage end? Was the policy fully paid out and on this date? That can then go into the BCRC and they can update based on that. If you're getting information from a primary payer, though, you do want to make sure that it is on letterhead from that payer so that the BCRC can recognize that. Once you fax it in, and again, that contact information is available on the CMS website, they will get the information updated. You do need to allow approximately 2 weeks for that to happen. Last, let's say you can't get an update, you can't get any of that information, you don't know what to do, but you do have this claim and you don't want to miss the 1-year Medicare filing deadline. You can always submit the claim to the primary. If they deny it, saying, hey, not covered for this data service or not covered for this service, that's fine. Once you get that denial, you can submit Medicare secondary payer with the denial. The denial will then allow you to say, hey, they didn't pay it, and here's the information you have to know, and then we can process it. Now, again, talking about the billing section of it, please attend that billing class coming up, because it is very different for the type of claim that you submit, whether it's the UBO4 837Is or whether it's the 1500 837Ps. Because it's so different, I do not want to try to get into that during this class. I just think it'll be very confusing. All right. Another question that we had is what do we do when an auto liability is listed, but this claim is not related to that auto liability? And the actual answer is you're going to bill Medicare as primary. However, you're going to indicate on that claim that it's not related to the liability insurance. Keep in mind, Part A and Part B claims, again, the UBO4 837Is versus the 1500 837Ps do this differently because they have certain pieces of information that are different. So again, I don't want to get too much into that billing stuff because there's just a lot of back and forth that go with that. So we'll keep that as general or information as we can for now. Let's go ahead and see if we have any questions that were submitted in the meantime.
Tom, the one question that we had, and I think you just answered, but I'll ask the question. Can you possibly show how to do one? I'm assuming it means a claim. That's going to be coming up in your billing presentation. Is that correct?
Yes, Alan, that is correct. And why don't I take a moment, and what I'll do is show you guys where to find that information if you'd like that. So if you come to the WPS website, WPSGHA.com, I know it does say Med right here. You can ignore that, it's a temporary, so we do have a redirect in place that'll automatically bring you to this. Go to the training center. Now, don't need to select J5, J8, or any of that, just the training center. Once you're inside the training center, check out our live events page. This is our catalog. Now, you'll see our calendar indicating that we do have different courses going on and the day that they're going on, but I always recommend come to the live events page right away. Inside the live events page, we're going to scroll down. You can see right now we're in this class, but if I continue to scroll down, and I want to scroll down quite a ways here because it's going to be in April. Let's see, what do we got? And this is Medicare secondary payer right here, April 16th. So if you bill on a UB04 837I, those two institutional transactions, you actually bill to the Physical Intermediary Standard System. It's called FIS. You'll want to attend the 16th. If you bill in a 1500 or 837P electronic transaction, you want to attend the 18th. Great opportunities for you guys to get all of that billing information. Now, keep in mind, it'll also cover things like, hey, what modifier is related? Do I have to put zero payment on there? All of those types of things we'll go through. But if there's some stuff I can help you out in the meantime, I'll definitely be willing to do that. The last course I want to make you aware of is on 5/7. This is our series wrap up. Again, as we stated, we thought we would only have 3, which actually would have been October, November, December of last year. We're still in the middle of this, and you can see it's going to go all the way into May. So we wound up with a lot more than we thought we were going to. But I do want to give you guys the opportunity to attend the series wrap up if you're interested. Again, by registering for that wrap up, you'll be given the opportunity to ask any questions related to any of the other courses, though some of that may be referenced out back and forth. All right. Any other questions come in, Alan? Sorry.
That's okay. We have one additional question. Is there a modifier that providers can use to identify the service is not related to an open liability case?
Good question. And actually, there's not a modifier for that situation. What you would do, depending on the type of billing, would be a condition code or something like that. If you're a Part A biller, again, Part A being UB04 837Is. Otherwise, you're going to use the narrative field on the 1500 837Ps. Now, again, sometimes it's getting denied and you're going to have to do some other additional work. But again, that'll all be in that class coming up next month. So take an opportunity to listen to that. I really will encourage you, if you have billing type questions, to listen to that. Any other questions?
That's all we have at this point.
All right. I did have some other questions come in, and this is where the resource section came in. Now, I've shown you a couple of things. I do want to spend a little bit more time on those, and then we're going to look at a couple of things on the WPS website as well. So here's some base resources for you. This is what we're going to take a look at, but I do want to cover a couple of different things in regards to these resources and other resources. So hopefully this slide just gives you the basics of them, and then we'll get through the website here. So first thing someone asked me is, if I'm looking for Medicare secondary payer training, in addition to what you've given, is there a place to go for it? And the answer is actually yes. It's back on this page right here. And in this Medicare secondary payer section, so again, we're going to go to Medicare secondary payer. When that opens, if you scroll down to the very bottom, well, as you scroll through, you'll actually, I'm sorry, I went too far. You'll be able to read about some of the different situations and things like that. It's a great opportunity to read through all of this. But by scrolling down to the bottom, and I'm just trying to get there, you'll see related links and then providers and beneficiaries. So this is where you're going to get the bulk of your training. Now, it doesn't mean that this is all there is. CMS does have training classes available if you want to look at those, and you can definitely take the opportunity. But I think this is a great place to start with that training. So hopefully that helps you. There is, again, listed, there's some CP trees under download section below, and they'll tell you how to get to those curriculums and different things like that. I think this is the best place to start and then move from there if you are looking for some additional training. So that's one source that we definitely had. A couple people asked questions regarding MSP and end-stage renal disease and what does that mean? And this is going to be right here in this section. It doesn't affect like a liability insurance or anything like that. If the person has Medicare and they're in a car accident or they fall or anything, it's not affected. However, where it would affect is group health plans, and they're under a separate category because it was a separate section of the Social Security Act that began them. So while MSP isn't affected, the eligibility portion is. So I would recommend that you take a look at this end-stage renal disease section, and it does talk about that. The question in regards is in this middle paragraph that I'm highlighting right here on your slide, and it's in regards to the 30-month coordination period. And what they were wondering is, what does that mean? And the basic gist of this is that during the first 30 months, the other insurance is primary. Once the person reaches 31 months, Medicare will become primary. So it's a coordination period. It is very different than any other form of Medicare secondary payer situations. But I wanted you to at least be aware of where to find that information. We do also have a variety of courses and different things that will cover that more in depth. One of the catches with the coordination period is in most cases it's active employment, in which case the Consolidated Omnibus Budget Reconciliation Act, COBRA, is excluded because it's not considered active employment. That's not this case. This is a very separate section written as the law, so therefore it would be included in that 30-month coordination period. But again, hopefully I got enough to answer your question and not going too far into that. A couple people asked, is there like something that may be helpful in terms of when an overpayment comes in and when you try to do an appeal and all of that? I will recommend a couple of resources to you here. And these are in the Medicare Learning Network area here. So what we're going to do is we're just going to look at resources and training. And again, it was just training and education, a little bit different than Medicare. You go to Medicare Learning Network and we're going to go to resources and training. I like the publications and media because that's where you're going to find these. Once the publications and media opens, if I just type appeals, it'll walk you through the Medicare appeals process booklet. I'm not going to go ahead and open it, but it's a great booklet. It's going to give you all the basic information. It's got some beautiful charts in it to help you out. So if you're looking for Medicare appeals process, this is what we're talking about. Now remember, you're always going to appeal the overpayment versus the claim, because the claim may have already been processed months and months and months and months ago. So you want to make sure you're aware of that. You can also do the same thing if you're looking for more information on overpayments. And you can see then it brings up Medicare overpayments. It's another fact sheet. This one I'll open up. It's a little bit, it's a lot shorter, so it's a little bit easier to open this one up. You can walk through it and read through the different pages and section, but it's just going to explain about the overpayment process and anything else that you'll need to know and when this occurs. So there's lots of just basic information if you're interested in that on the CMS website. Those are some different resources I really recommend. But again, never forget that the IOM is there, that internet-only manual with those day-to-day operating instructions. It's going to give you all the information you need. It might be a bit overwhelming to understand and to sort through. I do understand that, but it is going to be your primary source when it comes to those day-to-day operating instructions. All right, let's jump back to the WPS website. A couple of resources I want you to be aware of here. We've talked a little bit about the portal, and the portal is just our secure section. See the login right up here in the top. But we do have a portal user manual. And the reason we bring this up is because before you submit a claim, you should check and see what the Medicare processing systems have in it. Now, how do we know it's in the processing system? Remember, we said it goes to the coordination and benefit system, which then goes to the common working file, which then goes to the processing system. So you want to take a look at the information in the common working file. The only way we have for you to access that is through the portal, the IVR, or the direct data entry system. So the portal user manual is great. Always recommend this. If you want to look at the full manual, select that green download button. If not, pick a section. You can kind of go through, you'll see it all. Now, because you do have protected health information and personally identifiable information along with provider information inside this system, it does require a login. I'm not allowed to log in. I don't need it. I can just kind of talk you through the manual here. When we look at this, we want to scroll down and we're going to go all the way to the bottom. You're going to go to the claims transactions. As part of that, you'll have the eligibility check. Inside the eligibility check, one of the features inside our eligibility check, and you can see how to locate all the information, will actually be a Medicare secondary payer feature. So when you come in and it says no information available, like this one, and it's in gray, guess what? There's no information available, so there's nothing more we're going to give you. On the other hand, if we do have information, you can select it. And the reason that we recommend using this feature is that it's going to display a lot of the information that you need, all the different plans that we have. Now the IVR will only display the last 3 records. So if there's more than 3 records, you won't have the full information. This will display anything we have along with the direct data entry screens. So if you want to take a look at that, I do recommend you take a look at that information. If you want to know what actual MSP information is available, scroll down, you can see the red box starts, and then it starts with summary. We just got to scroll down until we find the part called Medicare Secondary Payer. I'm just scrolling through. You could also do a find on this, that's fine as well. And here we go. Now, this record says, hey, for MSP, you'll find enrollment and termination dates, again, policies, all of these different things. So make sure that you're aware of this. All right. Same thing if you're looking for it and you do happen to use direct data entry, we do recommend that you go into the J8 or MAC Part A or J5 MAC Part A, just depending on where you're at. You're going to look at the claims area because that's what we're talking about here. We go to Topic Center, go to Claims. Once inside Claims, you'll see this direct data entry overview. Don't have to go any further than this. The overview will give you a basic information, again, for direct data entry. Keep in mind that once again, direct data entry is only for those that submit on a UB04 or 837I institutional transaction. If you don't, then this will not work for you. It's not designed for Part B. It won't access that at all. So I think that's a great opportunity for you guys to check that out, and you can read through your login. Here's the manual way down in the bottom. The manual will also walk you through the screens and what information you can find. So again, I think it's a great tool. Really like those tools for you. Hopefully they will help you a little bit. The next question that came in was actually regarding appeals. So again, we have a lot of information on appeals and they are available to you here. This is just, again, the Topic Center and appeals, and then you can go through how to appeal a claim determination. Right, here's our instructions and it'll walk you step by step through how to do that. So I would really like you guys to take the opportunity to do that, and you hopefully are aware of now where to find that. Okay. Let's see what we got going on. All right, in the next section, I guess, is going to be questions. So Ellen, do we have any questions?
Tom, we do have a question. The provider says our claim denied, stating that Medicare was secondary, but the WPS portal section for MSP is grayed out. They called our customer service department and did find that the common working file has been updated. The customer service rep, however, will not provide that primary payer information. Is there a reason behind that?
So there's certain pieces of information that we're not necessarily allowed to give you, especially if there was not a primary payer record that should not have been there, then that isn't correct information. So as long as it's grayed out, you just want to resubmit your claim as if it's a new claim. It'll go through the processing system. It won't hit up against that again. So that's how you're going to get through that. So the reason behind it is actually because that record doesn't exist. So we as customer service wouldn't know what was in it. So if it's not showing a record that grayed out like that, we can't see what was at one point in what we're going to call the coordination of benefit system. Because remember, it comes through the common working file to get to us. So they may not even have access to it. They may not know it. If it was something where it's terminated or whatever, that's all something the coordination of benefits contractor, remember the BCRC? They got to handle all of that. So our customer service representative may not have any idea what's going on in that COB system in that manner. And I think that's probably what's happening, but I can't answer exactly. I just know once the claim is there and if it's denied and you go and everything looks good, record's showing, nope, nothing, wasn't ever a record here, don't know what it's here for, then go ahead and resubmit that claim, send it in again, and we'll get that process for you. So again, they may not have access to it or maybe a variety of other reasons that may have come up. All right, let me do a pre-submitted question. What do we do when an auto liability is listed, but the claim isn't related? And we talked about this. This is going to be in that billing class, but I want to make it very clear you want to do that. Next question. They're struggling to get that auto insurance removed. Is there any advice? And here's where I'm going to kind of use some terminology because I'm not really sure what you're saying with this one. When you use the term removed, are you trying to get it removed like what this other person is describing, where it just doesn't exist at all, in which case no one would ever see it again? Or are you trying to get it end dated, saying this is when that auto insurance benefit is done? Because they are very different actions. If we're trying to get it end dated, we do not want to remove it. There is still potential that a claim could come in from the previous or the past. On the other hand, if the patient's never had it, that would be a removal that would go through. But either one of those first need to start with the BCRC. The Benefit Coordination and Recovery Center needs to update that record. Now, again, until it's updated and comes into the common working file, which is what the claims processing system has to go to match, we can't do anything as a claims processor. We're kind of stuck. So we're going to go back through with how do we get that BCRC record updated. One, you can have the patient call them. They'll talk it out with them. Two, you can call with the patient and the patient can give you permission to act on their behalf. Three, you can get a record from the primary insurance on their letterhead or some other way and send that in to get that updated. Once that's done, we'll get that updated. Four, you can send a claim to them and then just for that one claim, bill Medicare saying it's denied for whatever reason the denial is. And again, that'll be in the billing class. You want to make sure you have all of those different pieces of information, but those are your different options that I have for you. All right, Ellen, do I have any other questions?
We don't have any further questions.
All right. All right, so with that said, I would like to thank you for listening. I would love to encourage you to take that feedback, give me the good, the bad, the ugly, tell me what you think, help me improve. Also, to be continued represents the fact that we still have more MSP webinars coming. Whether you want to attend the billing one or that wrap-up one, whatever you want to do, please take the opportunity to see those in live events and get a hold of those. In addition, please make sure that you're keeping track of all the current information and happenings. If something changes, you want to be aware of that on the CMS website. So on behalf of myself, Provider Outreach Education, and Ellen, thanks for participating. We look forward to your survey comments, and we hope that you'll join us for more education in the future. You may now disconnect.